The Genetic Metabolic Center for Education provides educational solutions to improve the health care of children and adults with metabolic disease. We do that through a series of different programs that address the different needs of this community, and this is the first time that something like this has ever been done. The area of genetic metabolic disease is a field of medicine which is sorely underserved. The tragedy is that most patients with these disorders are walking around without a diagnosis and therefore don't gain access to treatments that could really improve the quality of their lives. Even though we are geneticists, we are not replicating very well. The patient community is growing, but the provider community is not. What we hope to do is assist those physicians who are taking care of these patients if they haven't been properly trained, and to help specialists who are seeing these patients make a diagnosis so those patients can actually get the therapy they need. We're starting out with a consultation service, which is a way of assisting physicians who were never trained in the area of metabolic disease to better diagnose and manage the patients they're taking care of right now. For the subspecialists, like the neurologist, the gastroenterologist, the neonatologist, they see patients with symptoms that raise concerns about a metabolic disease. But the problem is, these patients don't walk in with a diagnosis on their foreheads. They walk in with symptoms. And so we're providing a symptom-based approach that they can apply to those cases to get them to a diagnosis. The center is developing a number of different educational programs to address the different needs within the metabolic community. Later this year, we're looking to roll out our newborn screening webinars. Now, newborn screening is the largest and most successful genetic screening program that exists. As newborn screening programs are expanding, we're identifying patients with more and more disorders that not all providers are familiar with. And so what the newborn screening webinars will provide is not only information about the policy and practice of newborn screening, but also how to confirm the diagnoses that are questioned through the newborn screening program, and if those patients have a diagnosis, how to initiate management. For specialists who see patients with symptoms that could raise concerns about a metabolic diagnosis, we're providing day-long conferences that are symptom-based approaches. They will have access to a number of different resources in a specialty-specific module. These modules will include symptom-based approaches in an interactive setting, also patient videos, so videos of patients or family members who talk about living with a disease. There will also be references to read to supplement their knowledge, and there will be a self-examination section to test their knowledge acquisition. There are many stakeholders in the metabolic community. There are patients and families. There are physicians who manage these patients. There are specialists who see patients with symptoms but may not know what they're seeing. There are pharmaceutical companies that are manufacturing products for this community. Formula companies, specialty food companies making products. There are disease foundations who care that their patient population be diagnosed and treated. GMCE shares the same mission. We want to see patients diagnosed and treated. The Genetic Metabolic Center for Education is looking for clinicians to get involved. If you are interested in participating in our programming, visit us at geneticmetabolic.com.